Good morning. This session, session 5, is on opportunities to scale and spread solutions to address care force challenges. And we have 3 presentations from very different aspects of the oncology workforce. Our first presentation will be by teleconference, by audio only, from Dr. Harold Paz. Many of you here yesterday heard him speak yesterday. For those of you who are new with us today, Dr. Paz is Executive Vice President and Chief Medical Officer for Aetna. He leads clinical strategy and policy at the intersection of all of Aetna's domestic and global business. Prior to his time at Aetna, he served as Chief Executive Officer of Penn State Hershey Medical Center and Health System, was Senior Vice President for Health Affairs for Penn State University, and Dean of its College of Medicine, and Professor of Medicine and Public Health Sciences. Let's hope no technical challenges. Dr. Paz, you're on.
Thank you very much. The only technical challenge is the camera doesn't seem to be working, but fortunately the phone does. And it was great to be with all of you yesterday. Apologies for not being there this morning, but I'm delighted to have this opportunity to discuss payment and health insurance from the perspective of the solutions to address care force challenges in oncology. So as we've discussed throughout this workshop, cancer treatment continues to grow in complexity and cost of care continues to rise. And while the cancer care force continues to face challenges in delivering to patients, I would say that the biggest challenges of our time are in delivering the right treatment to the right patient at the right time. My focus at Aetna has been on personalized health and developing solutions to deliver those solutions to the individual, beginning in the home and in the community, and to identify solutions that work best to advance every individual's aspirations for health and wellness, particularly those with chronic illness. Today, I want to share a few examples of what Aetna has been doing to enhance the delivery of high-quality patient care in oncology. And my hope is that our successes may provide a blueprint for others as we seek ways to scale solutions that have been working regionally, but on a national basis. So first, let me spend a few minutes outlining how Aetna approaches these issues at a high level. Our cancer care strategy, as with everything we do, is to keep patients at the center of care, to truly personalize health. We work to reward physicians and other clinicians for using the most current evidence-based medicine, not the number of services that are provided or strictly buy and bill on drug margins. We are, I believe, I would hope, the leader in oncology quality and cost management through our multifaceted, patient-focused approach. And our goal is simple. We help cancer patients receive quality care with fewer side effects, appropriate treatment, and potentially lower costs. We focus on improving quality of care for the patient by adhering to the best practices and clinical pathways that are NCCN and peer review supported, as well as incorporating best practices to elevate the level of care. Practices can receive enhanced reimbursement for prescribing equitable generic and can also receive a portion of the savings generated if they achieve quality metrics. These quality measures have typically demonstrated an 80% compliance rate with agreed upon clinical pathways or best practices. Our overarching philosophy for managing drug costs is to do the following. First, to support individualized treatment based on clear evidence. Second, to use care management and benefit design to encourage adherence, and to move value-based arrangements that reward positive outcomes. And finally, to drive appropriate use through utilization and formulary management. For oncology care, we collaborate with physicians to make fundamental changes that are sustainable and to create improved outcomes for patients. Our approach supports clinical pathway adherence and a large number of sophisticated oncology medical home practices. One such program involves Oncology Medical Homes, as we call it, or OMH. An OMH is an enhanced delivery model that centers on the patient and encourages practices to make key changes to how they operate and deliver patient care. The model brings together an engaged practice with enhanced reporting for better health outcomes. Aetna has 22 practices across 18 states, where approximately 750 oncologists work to deliver patient care through what we call a care team approach, meaning that every clinician in the practice is working at the highest level. The basic principles behind this model include a care team directed by a physician with whom the patient has an ongoing relationship, enhanced patient access to the care team, including after hours and weekends, and improved shared decision-making between the patient and their doctor. In addition, a focus on improved health outcomes through the use of evidence-based care, and finally, a reimbursement model that rewards doctors for improved health outcomes, which often leads to decreased cost. Aetna seeks to reward practices that commit to developing an oncology medical home by including an upside risk arrangement, allowing them to share in the savings resulting from more efficient and effective care. This evolution of traditional fee-for-service type of reimbursement rewards patient outcomes, not just drug selection. The patient outcomes specifically targeted are improved avoidance of expensive inpatient hospital stays and ER visits through improved chemotherapy adverse effect management. And at the end of the day, this becomes a win-win for patients, for physicians, and for Aetna's customers, those that support the health benefits for our members. Because as the patient experience is improved, quality is enhanced, and the total cost of care is reduced. For an oncology practice to become an oncology medical home, it must have the following characteristics. First, it must meet patient population thresholds, and that would be at least 50 members on a chemotherapy regimen. Second, it has to use Aetna-approved clinical decision support tools for pathway compliance. It needs to be able to use electronic medical records. It should employ a nurse navigator, and it should have enhanced triage, and finally conduct and report results of a patient satisfaction survey. Aetna is launching in mid-2019 a pilot program deploying a user-friendly clinical support tool that incentivizes high-value evidence-based oncology care. This tool can automate the prior authorization process, decreasing the administrative burden that we discussed yesterday. The program is based on our belief that oncology continues to grow in complexity as a result of an increase in the number and types of new cancer cases, limited service networks imposed by drug manufacturers, and an increased complexity of testing, treatment, and disease management. We're implementing these and other pathway programs on a market-by-market basis, where Aetna does business, with participation by community oncology practices and hospital systems. So as you can see from the initiatives that I've outlined here, Aetna is working hard to enhance the delivery of high-quality patient care in oncology. Our oncology care strategy, as with all disease states, is to think of the patient first. Innovation is a critical element of that strategy as we work with providers to ensure our members have the best, most cost-effective care possible. It's something we continue to develop and evolve and grow, and it resonates with what I described yesterday. Beginning with the patient, identifying evidence-based approaches that optimize care to allow individuals to achieve their aspirations for health and wellness, to create a health ecosystem of solutions around the individual, again, focusing beginning on the home and in the community in which they live, and then to reimburse and to pay for care through value-based mechanisms in as much as we possibly can. Thank you for the opportunity to talk a little bit about what we're doing in terms of our partnership around care delivery, and I look forward to answering questions later in the session.
Thank you, Dr. Paz.